Hi, everyone, and welcome. I'm so glad you could join us today for our first Drive to Vive session, RCM Pulse Check: What's working, what's broken, and what's next. This conversation is the first part of a four-part Drive to Vive webinar series, our countdown to Vive 2026. Vive 2026 will be February 22nd to the 25th in Los Angeles, California this year. It will bring together leading industry voices all around health IT, the business side of healthcare, cybersecurity, interoperability, and many, many more. So we hope you will join us. Each session in this series brings together industry voices and thought leaders to share what's really happening on the ground in healthcare today. It's all about building momentum and connection as we head towards Vive, where those ideas and innovations will come to life in person next spring. We're especially excited for today's discussion, presented in partnership with Magical. The revenue cycle world has been through a lot. Denials are up, processes are stretched, and teams are doing their best to keep pace with nonstop change. Today is about getting real about where we stand and what it's going to take to move forward together. We're so lucky to have Vanessa Moldovan, host of For the Love of Revenue Cycle podcast and head of RCM strategy at Magical. She is leading the conversation today, providing wonderful practical insights. Vanessa is going to walk us through how focusing on denial prevention, education, and smart technology can help us fix what's broken and build what's next. A quick note before we start. Feel free to drop your questions in the chat at any time. We will make sure to have a portion of Q&A at the end. And yes, this session is being recorded and will be shared after the event. With that, let's dive in. Vanessa, welcome. We're so glad to have you
Thank
here.
you. Thank you. Thank you. Welcome, everyone. My name is Vanessa Moldovan, and I am the head of revenue cycle strategy at Magical. And also, as Mary noted, I am the host and creator of the podcast For the Love of Revenue Cycle. So excited to be here today, partnering with Vive, Magical, all of us together to talk about something really, really important, which is the current status of revenue cycle. And it's the truth that we all feel. It's at a breaking point. Denials are rising, workflows are fragmented, teams are overextended, but it's not because people aren't talented or committed, but because our systems and our rules just keep shifting. And we patch the gaps with these, manual workflows. So in this session, I'm going to show you what's broken, which we pretty much have a good idea what that is. But then we're going to talk about what's working and what's next, which is what's really exciting. Most importantly, I'm going to give you a precise starting point that you can execute in the next 60 to 90 days. And if you lead a team, this will help you guide changes. And if you run the day to day, this is going to help you advocate for what works. So let's jump in to our first part, which is what's broken. When we start talking about this, it's funny because the next question is what's not broken, but we are going to narrow it down today. We got to keep it narrow. We only have half an hour or so to talk about this, but I feel like these are key parts of the revenue cycle that are broken, leading into our solutions that we're going to talk about today. But the first one is, that denials do continue to climb and processes do remain fragmented. The tech that we brought in to solve problems sometimes creates little side workflows, manual interventions in between systems just to get through organizational realities, add more fragments. And the result is time spent on this in between work instead of the work people are qualified to do. And then that downstream effect is that the denials continue to rise. We also see some of those denials rising because of, let's say it, the payers do continue to add to these reimbursement guidelines that we have to follow in order to receive reimbursement. And so sometimes, we have these non preventable denials, we just can't. And to meet those qualifications that the payers have, we can't meet them. And sometimes, again, that leads back to the tech that we're using. So, for example, we have electronic claims. We need to send claims electronically. It really is the most effective. But then we have some payers that require that documentation to go with that claim. That leads to a denial. So there are those situations. But then we have like preventable denials. Why do those continue to rise? Well, that kind of leads into this second part of what's broken, where teams are reactive instead of proactive. And, it's because they are might be using outdated tools, they might have incomplete data, which leads into the, lack of education that they have, the lack of knowledge that they have around the operations. But sometimes it's just they are just overextended. They've got too much on their plate. They can't possibly get it all done. And what we're sacrificing is the quality, right? So when you're being really reactive and you can't be proactive, that leads to more errors, which again, that downstream effect is leading to those denials, which continue to rise. And a perfect example of this is prior authorizations. The request for documentation increases the requirements for prior authorizations, increases. We're just trying to keep up with all of those changes, right? And it's really tough. And again, it can lead to those denials. One of the things about the revenue cycle, which I'm sure most of you know, is that there's a reason it's a cycle, right? There's a reason that it's visualized as as a circle because everything that happens within it impacts another part of it. And so denials are they're definitely that downstream. So everything that's happening upstream is impacting downstream, which is why, again, I mean, we could spend a really long time just on this particular part about what's broken. But what's really important is that we we are able to um, have the visibility into what's going on within the revenue cycle. And this is another part that is kind of broken and is leading to these challenges that we have within the rev cycle is that we don't have that visibility. Root causes are essential to being able to identify how we can make improvements, right? So, how can you fix something if you don't know what's truly broken? And that's the key to root causes. And so this is where leaders are really challenged is they don't have that visibility. And we're going to dive a little bit more into some of this too. But I think that these are kind of cornerstones of what's leading to these challenges that we have in the rev cycle. And I've been doing this a really long time, and so, it's like we see these little improvements that happen along the way, and we make a little bit of progress, but then it feels like we take a few steps back. So I hope that in our conversation today that I know it feels really like hopeless and like we're never going to get there, but I promise we're going to talk about some things that are working. So first of all, I have to say initially with what's working within our revenue cycle is the people. And personally, I think that it's always been the passionate people across the industry that has made a difference in our revenue cycles. Every single time that we're going forward and that we're making improvements, is because there's people that are working all throughout to find those solutions. They identify the problem, they're looking for the solution, and we're just not going to give up. So even though even though it feels like it, that it's just going down the tank, we're not gonna give up. We don't go into this profession because we wanna make a bunch of money. We go into this because we are passionate about it, and we're passionate about the providers and, obtaining reimbursement for those providers. We're passionate about the patients, and so that the patients can get the services that they need to get, and that's why we stay, and that's why we continue to move forward. And if you have any doubt whatsoever that this is what's really working in the industry, you can just take a look in my Facebook group called For the Love of Revenue Cycle. There's 4,000 professionals in there who are having conversations all the time about how can we fix this? How can we make this better? Another thing that's really, really working is growing collaboration, genuine collaboration. There are payers who want to collaborate and get it right. There are tech innovators who genuinely want to solve problems instead of creating new ones. And they're taking the time to truly understand revenue cycles so that they can help. And I can tell you this from personal experience. This is exactly how I met Magical. Was that I work with tech companies to help them to understand the industry, help them to understand the people, help them to understand what the real root causes are and the real root problems are so they can truly come up with a solution. And yes, it is true, even if you might be a little bit skeptical, there are payers out there who really do want to do better. They want to collaborate, they want to learn more, they want to get it right, they want to be efficient, they want to get those claims paid, they want to get members treated, they want those services to happen, they want their providers to be serviced. And so they're also collaborating, they're working to that toward that as well. And one of the ways that I personally believe is at the core of continuing this collaboration and continuing with what's working is education. So and this is what's currently working is we're seeing expanding education growing for the front lines, for payers, for tech innovators. And so we have conferences, podcasts, workshops that are geared to the people who have that most direct impact on our workflows. So when payers in tech understand the reality of revenue cycle, it improves the entire, the whole field, right? So the entire industry. And this is happening, as we speak. More and more education is available, and actually attending those conferences, attending the sessions. There are more and more that really get to the heart of the problem, but not just that, really speak to that audience. So it's important, like when we're talking about revenue cycle, we're talking about denials, we're, talking about technology, that it is framed in a way that each of these stakeholders understands it and they can apply it to what they do. And I'm seeing this more and more that this is working. We're having a bigger impact. We're getting out there and getting the message across. So before you give up, hope, like we talked a lot about what's broken, we feel this pain every single day. There are a lot of things that really are working. And you who are, listening to this webinar right here, you're a part of the difference that's happening. So, what can we do next to bring about this change that we really, really need? So, what's next is we combine this energy of what's working with a clear vision of what's broken. And that's how we create what's next, which is big change and good change, that's coming along. But we need to focus on a few things in order to get to that change. I think that all of us here want to see that difference. We want to see that change. We want to see the relief. We want to see our teams not so stressed out. We want to see our teams not so overextended. We want our leadership being able to say like, "Yes, we found a solution." And the what we need to focus on is for to prepare for what's next is that leadership accountability, workforce education, and smart technology investments, smart, transparent technology adoption. So there's definitely opportunity for transformation here. And improvement depends on collaboration and depends on informed decisions at every level of the revenue cycle. And because we can't fix everything at once, as much as, we would love to be able to do that, that's just not really a reality, right? So a lot of the first question will be, and I work with many organizations who are like, okay, that's great. We know what's broken. We know we've got these opportunities over here to be educated. We have these people that really, really want to do the right thing. And we know that we're surrounded by technology. So how do we know where to start? And the place to start is where you're going to have the biggest ripple effect, right? Is where within your revenue cycle can you take a look? Can you do a deep dive and have the biggest ripple effect within your organization and make some real change? Well, in my opinion, that is with denial prevention has the biggest ripple effect within the organization, within the revenue cycle. Denial prevention is the highest leverage starting point because it impacts every function of the revenue cycle and improves reimbursement and efficiency. Denials force that upstream visibility. So they connect what happened in registration, coding, billing, bringing it back to the leadership decisions about processes and tools. You can't fix what you don't understand, right? We already talked about that. So knowing root cause is critical. And that means segmenting those denials correctly, tying each segment to the actual process gap and not some vague label. So with our denial prevention is kind of under this umbrella of denial management. Under denial management, we have denial prevention and denial resolution. And we could have a whole webinar on just which one should we put more of our resources toward. Should we be more of prevention or more of resolution? Because the fact is, right, our denials are increasing. We've got those denials out there that we need to resolve. But denial prevention, this is gonna keep that bucket from getting bigger, and it has a focus on solving the problem. the actual root cause of it. So, what I love about denials, and if you have followed me at all, listened to any of my workshops or my podcasts or anything, I'm a really big believer on how denials are a really great barometer for the organization, the good, the bad, and the ugly, right? There is nobody that is, left alone. Their story isn't told in the denials. We don't work in a silo when it comes to revenue cycle. And the denials, even though they're such a pain, right? I mean, obviously, denial is a lack of payment. Nobody wants a lack of payment, right? But what's amazing is in this thing that, causes so many challenges for us is also the root of where we can find solutions and where we can fix things, and which is what I think is the beauty of it. When we're looking at the denials, we need to make sure that, and I'm not going to do a whole, this whole entire webinar isn't about a denial prevention project, but to give you some, takeaway and some action that you can, take back to your organization. When you look at your denials, remember that it's not just that bird's eye view. That's really important, right? So it is great to take a look at all the different reason codes, to take a look at it by payer, to take a look at location, provider, all these different things, but we also need that deep dive. Root cause is really important. The reason that that we received a denial is different than what caused the denial. So being able to do a deep dive into what actually caused those different denial categories, that's what's going to allow you to go back and make those changes and give, leadership the tools that they need in order to make those changes. Um, so really needing to know, I just really want to emphasize here, right? We want to make sure that we're getting to root cause. I think sometimes, we look at the denial reports and we just see the denial reasons or we see the denial category, and then we go immediately to that area of the organization that denial category relates to immediately, right? So we might see a denial that looks like, oh, that's obviously coding. So we're like, the root cause must be coding. So we're going to go to the coding department, do a whole, education, uproot things, change the process, whatever, implement some technology. That may not actually be what's causing those denials. So really important to do those deep dives. But with your denial prevention, you will then put processes in place to make those changes, right? To prevent those denials. So the first part of this, which it isn't just like, and all of a sudden, let's jump in and make these changes. There are some steps to it. Okay. So first, we need to really remember that real change starts with leadership. We need to, as leaders, we really need to stay informed about reimbursement trends, regulation changes, operational shifts. When leaders are informed, they can guide those teams through the change instead of reacting to it. I can tell you that in my career, which has been, a couple of decades. But I know people who work in rev cycle. I know the kinds of people who sit in those chairs. And yes, we've already talked about how passionate they are. But another thing about them is like they're really not afraid of change. They kind of live on that. They thrive on that, right? I mean, healthcare changes constantly. Reimbursement guidelines change constantly. Billing guidelines, like things change on a regular basis. Even the operations within the organization, they change because something came up, and we had to change it. So the very nature of what we do every single day, we're facing change all the time. And we go with those changes in order to get reimbursement for those services. So why is it then that when we hear that leadership is going to change a process or they're going to implement technology, why is it that we're like, oh my gosh, freaking out about change? Well, this is a really interesting conversation because, and that's what leads us to like, this is why it starts with leadership. Because what we're thinking is, oh my gosh, the people who are implementing these changes, they don't really understand the problems. They don't really understand the pain points. They don't really understand the processes. And so that's why it's our responsibility as leaders, the ones who are leading this change, that's why it's our responsibility to truly understand that. Because, like I said in the previous slide, like, how can you put a process? How can you change a process? How can you put something into place and say that you're implementing change if you don't really even know the problem? If you want the outcome to be more effective processes, more efficient processes, more reimbursement, members getting or patients getting the treatment when they need it, if that's really your end goal, then you must understand the problems that are really occurring and you must really understand the operations. The other thing that, is helpful with this basically this change management that we want to take place is creating a culture of that education, accountability, and curiosity. And it starts with us, right? It starts with the leaders. So we need to keep ourselves educated, asking those right questions, asking the why, behind it, but then also giving transparency and allowing our teams to also be curious and to also ask for that accountability. If you're going to implement a technology that is supposed to help solve their problems, then we're going to hold you accountable to that. And to have a culture where that's open, where we want that accountability so that we can all get to a point of solutions, which is where we all want to be. So it's not the fear of the change itself, it's how the change is handled. And so leaders can reduce that risk by being informed and being predictable and being open. So the next part that we want to touch on with relation to what's next, right, is knowledge. And we touched on this a little bit, but knowledge really is the best denial prevention. In my studies, in my career, and in my, personal mission to reduce challenges within the revenue cycle, I have found that this is kind of at the basis of these challenges that we have is the lack of knowledge, and it really is the key to denial prevention. We need to understand the changes that are taking place within our operations, the changes taking place within the industry, but we need to have that continuous learning across every single level, right? So that means from the top down. And so we talked about creating a culture where the teams know that they can receive education, where they can be curious, where they can have that accountability. So making sure that we're attending conferences, that we're going to webinars, receiving certifications, listening to podcasts. There's so much that is available out there. That is what's going to help us with denial prevention as well. And then we also need empowered teams. So it is education and absolutely on that content that you would for billing content, coding content, but then there's also education around technology that's really important. And I personally think I've just noticed over the last several years that there's this gap in the knowledge around technology and how to appropriately apply it to revenue cycle, how to apply it to denial prevention, and so we need to make sure that we are keeping our oh my goodness, keeping our minds open and, having these conversations and going to the right locations so that we can learn more about technology. And again, not, this is not an if, this is a when. Technology, we need to be empowering our teams with better technology. And then last, before we move into diving into that role of technology, within the revenue cycle, I do want to mention that networking is really key as well to knowledge or to denial prevention. And the reason I say that is because we're not really in a culture anymore where we are sitting next to our colleagues, right? There was a day when we all worked in big rooms with a bunch of cubicles. And so if I had a question, I came across something that I'd never seen before, I could just go to the next cubicle, walk down the hall, grab somebody who I knew was an expert in that and ask them a question. And we could knowledge share all day long next to each other. And that's just not the case anymore. So we have to really be intentional about that networking now. And it's really actually vital in my opinion. And so where can we network? We need to be in person to network. This is really the best place to network. So conferences are a really great place to network for sure. Shaking hands, identifying like what is your area of expertise? What can I learn from you? What can you learn from me? So again, that knowledge sharing, which is not optional. But then you can also, connect with people on LinkedIn by looking at their background and seeing, okay, this person can fill this knowledge gap for me. Joining, other groups that are out on social media, Facebook groups, Instagram, they're all out there, and finding people that you can connect with and network with. is just so important because there is so much that we have to learn, so much that we have to keep up with. There's no one person who can carry all of this knowledge, in their head and who can keep up with all of the changes. So networking is so vital. All right. So now we're going to talk about the role of technology, right? It's what you've all been waiting for this whole entire time. If you know anything about ViVE, about the ViVE conferences, you know that to them, in it is really, really important to bridge this gap between healthcare and technology and bring people together in the same room. Um, and like I mentioned earlier, this is so vital that we be doing this now for our revenue cycles. Um, so as we get closer to the ViVE 2026 event, I want to talk about being tech enabled, right? And it's really key. That word is really key. Technology should enable. It isn't a fix all. We still need alignment with people, with processes, and with the product. People remain essential in revenue cycle. Healthcare reimbursement is complex and it's nuanced, and that is not changing anytime soon. So if you care about compliance and you care about effectiveness, humans still have to be in the loop. This is really important. So technology enables us to do a better job. It enables us to have more effectiveness. It enables us to not have those, fragmented workflows, right? It enables us to have cleaner reimbursement. It enables us to prevent denials, but in order to do that, right, in order to adopt this technology that's so, so important and vital for our revenue cycles, we've got to learn how to evaluate vendors. There's just no way around it. Unless you have somebody, in your Rolodex per se, who is just, handing out the best of the best to you, and you're like, great, I don't have to do anything. It really is important that we be able to evaluate vendors, and we need to be able to not only understand the tech that they're talking about, but to be able to filter through the smoke and mirrors, right? What's the truth? What's not the truth? What is kind of just hype, right? It's maybe we're making it sound a little bit better than it actually is. And again, we could have a whole entire session just on vendor evaluation. But I would just say, because this is really something close to my heart because I know from experience that it's easy to purchase and to implement technology that doesn't really solve the problem. And it's too easy, right? Because we hear these presentations, we're like, that sounds great. They said that they were going to be able to solve my problem, and then we get to implementation, and it really doesn't actually solve the problem, and it creates more problems. So I would say that overall, again, even though there's a lot of aspects to it, I would say is be your own advocate. If a claim sounds too good, ask for the proof behind the numbers, ask for the formula, ask for a proof of concept. The impact of technology, it is real when you get it right and not so great when you don't. So dive into that information. If they're making claims, make them prove those claims. Historically, tech sometimes created new problems because selection didn't match the real process or the root cause. So, that is also why staying informed, which goes back to what we said earlier, and asking the right questions matters. And if you're the decision maker, right, but you don't necessarily really understand the process enough to identify whether it's really going to solve for that problem within the process, then bring on those experts onto the calls along with you, right? Because if they're the users, right, if they're the ones who are going to use the product, if they're the ones experiencing the problem every single day, bring them onto the call too. No one is expected, again, to know every single thing, but make sure that you are asking those right questions, define what your outcomes are, and then choose those tools that are really going to support it. Use technology to close those in between gaps so people can focus on the complex work only they can do. Do not focus on getting a technology that is going to be a fix all. We are not anywhere close. No technology is anywhere close to being 100% without people. And again, if your goal is for a positive outcome, but we still need people involved in this process. So I really encourage you to start with your evaluations, but remember that people still need to be involved. And it is an alignment that we need to have. People, process, product, they need to work together in order to get those outcomes that we really need within the industry. So, we're just going to talk a little bit about technology because, of course, I'm here, with Magical. Very excited to be here with Magical. And there is a reason that I am with Magical. And, I think I told you about myself, that I've been doing this a really long time, diving into revenue cycles for a long time. My goal is to get them, working as best as possible, right? Getting to 100% as possible. And we talked about how to do that, we really need to focus on denial prevention. And I believe that the agentic AI technology that Magical creates and it is magical, blows my mind. I'm not a tech person, but I definitely see the outcome. And, I can see the accuracy that's just incredible, more control that you have, measurable impact. So coming from the perspective of a, revenue cycle person, I mean, that's what I am, not a tech person. Agentic I believe is what is really going to give us that flexibility that we need to solve these, broken and fragmented workflows that we have all throughout our revenue cycle and start relieving this pain that we have. So probably wondering what the heck is agentic AI? Most people do. Most people have heard AI, that's going around everywhere. But I think what would be easier is if we do an analogy. I know for me, this was easiest to have an analogy for agentic AI. So first, you guys may remember, I'm not sure what the age groups are, on this call, but back in the day, we had MapQuest. So if we wanted to go to a destination and get there with the least amount of turns and get there, the first time, MapQuest came out, I think it was the late 90s, early 2000s, and it was super, super exciting. You would print the directions and they were fine, they were totally fine, like you would go step by step until something changed, right? So if something happened on the roadway, traffic got backed up and they start, having you go off an exit, you're like, okay, now what do I do? It didn't have any type of flexibility. It was just you had to follow those steps. And if you didn't, then you just had to figure out a way to get yourself there if something else happened. Then came GPS, right? So then came Google Maps and Apple Maps and such, and this gave us the capability to reroute if something happened. If there was a detour, there was additional traffic, it would allow us to reroute. And it actually like makes that decision for us, changes for us, every single time we make a wrong turn, it's rerouting. And that's really like the what you could think of as like the AI in our analogy is that brain that's behind that thinking in the GPS. And then agentic is kind of the next step, which is why we have this picture here of a self-driving car. So the agentic part of it, which agent, is inside of agentic, is the action that's being taken, is that agentic AI. And so if we think about, there's a lot of AI out there that makes our work easier, right? It can compile the information for us. It can put an eligibility response into a really great readable format or even put that data together in a way that we've just never been able to see before that makes it much easier for us to do our jobs. But the agentic AI takes the next step and it does it. It's the hands behind it all. And that just like with the self-driving, right? So the self-driving car has the AI in its brain, that's making all the decisions and is able to contextualize, self-correct, adapt, all of that. And then but it can actually do it for us, so we don't have to be behind the wheel anymore listening to, Siri telling us, "Turn left, turn right," right? It's actually doing it for us. So if that is agentic AI. And so we are now able to apply this technology into processes. And so the technology that Magical has created with these agents, they have a platform that it can be deployed across all kinds of organizations, across all kinds of departments. As you can see here on this list, revenue cycle is in there. But we work with providers, we work with payers, work with health tech companies, we work with government. And really, I have had the privilege of seeing agentic AI doing this real work and across these departments. But with revenue cycle, what's amazing is it gives that flexibility, right? We can fill in those workflow gaps that where we're using, spreadsheets, or we're going to extra portals, or we have our people doing this mind-numbing work that they just don't need to do anymore, because now there's this tech that's able to reason and learn and flex and change, and it gives you transparency, it gives you control. And we've achieved 90% and more accuracy with that full transparency and into what the agent is doing and why it did it. For me, coming from the revenue cycle, perspective, that is what matters most for compliance and for trust, and really being able to see with my own eyes what the agents are doing. And they are able to relieve that pressure from our teams, so our teams can focus on complex, that 10% that's super complex that we truly do need humans and their judgment for. So kind of back to, what we were saying about, what is broken, what is working, what's next, right? And we talked about that denial prevention. And this is a perfect use case for this agentic AI. All of these things that are upstream, the changes that we can make, that we can put into process, the things that, those little fragmented, workflows where we can put those agents in to do that work for our teams, and then our teams are not as overextended and, overworked, and just help organizations go from being reactive to being totally proactive with prevention. So, even though, we can't fix everything at once, we certainly can start where it matters most. So, starting with a denial prevention for sure. It touches every single function. It gives you that biggest ripple effect within your organization. And I just want to encourage you, right, to stay curious, stay educated, lead your teams through that change, because that path forward is blending our people, the process, and the technology to build those stronger, smarter revenue cycles. So now we're ready for Q&A.
That's great. Thank you so much, Vanessa. As a self-proclaimed novice when it comes to all things RCM, just in the year that we've gotten to know each other, and having you speak at our last ViVE with a workshop on revenue cycle management, which, by the way, for everyone, it was like 90 minutes on a Sunday morning. We had a really full room, and then Vanessa was like outside the door for like almost the whole day with people with questions and things like that. So really, she's an incredible expert and resource. So please take her up on any Q&As and check out what she's doing along with Magical. Let's get into a couple QAs if you're open to it, Vanessa.
Absolutely.
Well, it came from the chat. In terms of this one is specifically for me, just in hearing you talk about the agentic AI,
Mhm.
going back to something that you said about reason versus cause when it comes to a denial. Is that where you see really it helping kind of more the like common issues, the AI taking the brunt of that workforce? It's more administrative and things like that. So then the actual human workforce can focus on the important ones that are doing that deeper dive into the cause of a denial versus just the reason they're getting back. Is that kind of you see the most, I just would say, like the first and foremost kind of use of that's most striking to someone when they use like an agentic AI platform?
Yeah, exactly. You've hit it right, the nail on the head. So and it does take a minute to adjust, because we're just not used to agentic AI. We're just not used to it yet, so our brains are still getting there. But yes, absolutely. The agents give that the flexibility and the learning and the adapting where they can dive into that root cause, and they could review, a whole bunch of denials and be able to come back with like, okay, these are root cause. It isn't just the reason, but this is root cause, and then, enable the leadership to be able to make those changes.
That's incredible because that's the one thing for me that's just more of a layman. The cause piece, like you said, the AI can help with that too, or is that something
Yeah.
you deeper dive with talking to the insurance claimant payer and wondering why that was denied?
Mhm.
Both, but
Yeah, yeah, and the agentic AI can be taught to then solve it. So to do the work, which is kind of that distinction that I was trying to make, is that we have a lot of really great tech out there that, we have Chat GPT and like OpenAI, and we have the AI brain that's been added to, so like AI enhanced tools that are out there. We have a lot of them and they are helpful. Like there's no question about that. But there are parts of the revenue cycle. So a really great example is like eligibility and benefit verification. Actually, this has been around a long time, right? And we've had EDI for a long time. Then we added AI enhancement, and we added, reporting back that was more robust. and gave us more information like network status or, coordination of benefits or something like that. But we're still seeing the denials. And the reason is because we just don't have the people and the resources to take that information and then put it into the billing system because that's what really prevents the denial. It's like it's great to look at a report, but what prevents the denial is getting the information into the system, getting the patient accurately registered, the ID numbers correct, the primary, the secondary, all of that. That's what makes the difference. And that's where the agents add that additional step. And then you're not dealing with those, in the industry, we're still dealing with 50% of denials or eligibility and registration. And so we can make a big difference with that.
That's incredible. I know you touched on the end, and a little bit of the why revenue cycle is literally a cycle. You
Mhm.
talked about upstream things that need to be fixed before you actually get down to a potential denial. What's one upstream process that you think most organizations just ignore, but fixing it would dramatically increase, whether it's a quick fix or a more long term one,
Mhm.
substantial?
Mhm. Honestly, I think it's the front end. It's before the patient is even seen by the provider. And the reason why I say that is because we are still dealing with most of our denials are because of what's happening before the patient is even seen. So we're dealing with the eligibility and benefit verification, registration, prior authorization. This is stuff done even before the patient gets in the room and is the majority of the denials and the lack of reimbursement just altogether because you can get a denial, you can resolve the denial and get the money eventually. But there are some denials you cannot resolve. You're never going to get your money back, but they are preventable, on the front end. But honestly, there's so many steps and so many things that have to be done and you have to get it right in order for that reimbursement to happen. And we just don't have the staffing anymore. We just don't have the people anymore. We don't have the expertise. We don't have the time. It's all those things to keep up, with changes as well. So, I think that's where, like, if we can just, like, pile those agents on there, in every organization, it would make such a difference in the entire industry with reducing denials.
Yeah, I'm sure anytime we can reduce a little bit of burden on actual people that can focus on, like you said, the more complex problems.
Mhm,
At the end of the day, we are dealing with people and providers that have
mhm.
fence. There's real people at the end of all this, both on both sides,
Yeah,
patients. Um,
yeah, for sure.
well, that's great. As you think about the future of RCM teams, what's one skill you believe will matter more than anything else over the next 3 to 5 years? Something really kind of short term.
Mm. Yeah, that's a really, really great question, and one that comes up often, right? Because people are like, "I don't wanna lose my job, I'm getting replaced," and it is true. Agents do replace certain functions, right? So if you're doing that particular function, so I think that an important skill is actually being adaptable and being open to that change and being open to learning more. And, I think as far as like a hard skill, to learn would be to learn more about technology, honestly. I mean, and I think I said this in the webinar, it's not an if, it's a when now. For a long time, it could be an if we could get away with that. We can't keep our doors open anymore. And so, excuse me. So allowing yourself to be open to learning those skills of all kinds of technology. What is it? What's out there? Being open to that. Again, adaptability. Even though it seemed kind of weird, because like I said before, like healthcare changes all the time, and we kind of the nature of our job, like we're changing all the time. But with these changes coming along, and the root of it really is this tech, we need to be just more adaptable and open to learning that.
Yeah, I totally agree. And I really loved how you spent some time in the beginning about really talking about education, because I think that's
Mhm.
also important, right? Without, yes, you're understanding the tech side of things and how you can help complement that, but also understanding the gaps still of that technology and being able to speak to it, not just to leadership, which is
Mhm.
an important thing within your organization, but also the broader spec of what you're doing, other external
Mhm.
stakeholders.
Mhm.
So that piece is really great. If there's
Mhm.
anything, any revenue cycle management professionals listening or things like that, what is there like a main certification or something on AI? Or I know you attend a lot of conferences. We just chatted about how you were
Yeah.
kind of connected last week.
Yeah. Yeah.
Is there anything out there that you think anything more specific about like AI certifications or revenue cycle management education professionals
Mhm.
that you think professionals should be aware of?
Yeah. I don't know of any, like honestly, I don't know really of a specific one.
Oh,
I
that's okay.
think what's important that's kinda where that networking, came in, where I added that piece about the networking. What we do is still diversified, even though there is definitely standardization. Like I can give you an RCM 101 course, right? But there's still a lot of diversification and nuances and complexities within particular specialties and even geographic areas of the United States, right? With different payers and stuff. So I think that to identify where to start with that education is to ask your network. Ask those who are in similar environments that you are, who are pursuing careers or already in a career. Like, I want to do what they're doing someday. Connecting with them on like, how did you get there? What did you do? What did you read? Where did you go? What did you focus on? Because even like with the conferences, like you go to Becker's, you're going to kind of get one focus of education. You go to HBMA, you're going to get another focus of education, right? And and we shouldn't go to every single one, and it may not be applicable to you. But
Sure.
asking those in your network and colleagues and such, like, what was most valuable for you, I think is really the best place to start,
Mhm.
depend on each other.
That's great. And I know you have an over 4,000 strong group on Facebook that is still very engaged. So maybe that's
Mhm.
the start if anyone
It
is
is.
just looking to kind of throw a question out or
Yeah.
networks maybe in their region or something.
Yeah, and to just find, like, your person, right? I mean, there was back in
Mhm.
the day, right, when we had the cubicles, like, we always had our like, I went to that person all the time
Right.
because we both did PT or, whatever. And so that's a great place to, like, find your person, like, okay, I can see you work in a similar organization, you're doing a similar, a specialty. Let's, get together, work on this together, and be kind of each other's resource.
Yeah.
So yeah, it's a perfect place to do that. Yeah.
No, I think you're great. I think taking that mentality of how someone would just reach over down the cubicle from
Mhm.
someone might seem a little harder now as a lot of us being remote and things like that, but it almost gives you access to even more people than
Yes.
before. You just have to be brave to
Yes.
do it and
Yeah,
um,
yeah, yeah, yeah. It's true. It's
just
true.
talk.
Yeah.
No, I think that's great. Last one that I'll
Okay.
is frontline teams are overloaded, as we talked about.
Mhm.
Agentic AI platforms and agents that can come in and help relieve some of the burden is obviously a plus. But what else can leaders do to kind of create that space for improvement without burning people out too much besides just the tech? Is there anything else that they can do instead of adding more work? Some people might say, well, that tech is great and might be able to help in the long run. Then I have to learn that and things like that, which sounds like a silly problem to have, maybe if it's going to help in the
Mhm,
long. But it can still be very overwhelming. We all have our own personal lives
mhm,
and things like that. So,
mhm,
pouring something big into your professional day to day might just seem a little bit daunting. Is there anything
mhm,
else they can be doing or just be mindful of when it
mhm.
or things like that?
Yeah, I think what can help with some of that overwhelm that we experience is actually just having a conversation with the leaders and the decision makers, the ones who are kind of changing those processes and bringing those changes in, and just get some of that out. Like what am I overwhelmed about? And what really are the expectations here? Because to be honest, like Mary, sometimes we create that overwhelm and it's not real, and we create it because sometimes the communication isn't great within the company. And so they just keep telling us, this is changing, this is changing, this is changing. It's like, oh my gosh, oh my gosh, oh my, And so talking it out with the right people of like, okay, you put this change in place. I'm assuming or I'm making this, a change in my own work, every single day. And you may find out like, oh yeah, that's not what we're expecting. And on the flip side, the ones who are making those changes and the ones who are, leading those initiatives may not even understand the impact of what they've done. So it opens up that mutual conversation to really get into alignment. And even though it may not change your workload, honestly, it may not. It really does help with like, well, at least they know. At least at
Mhm.
least everyone is aware that I'm responsible for 1,000 claims in one day. At least I've told them like I cannot get through 1,000 claims a day. You know what I mean? That really helps to relieve that overwhelm and that stress. Communication is key, that clarity, that transparency, and working together on both sides, because I have found with leadership, sometimes they just don't have a clue. They just don't know what's going on with front line. So
Yeah, until you speak to it. And I think, like you said, across the board, even when a tech provider's coming in, they might have something that's amazing that solves your problem, but
yes.
not for you end to end. That know your deep inner workings of how, and it sounds so simple, but we
Yeah.
a lot of the same themes too at Health and Vibe that come up that are simple to that. Take me back to the basics, really understanding your
Mhm.
needs, which sounds so simple. But when you start thinking of, well, this is a great thing, everyone should want it. Like you said, by region, by state, a country, everyone but differently. So really
Mhm.
and those needs is important.
Mhm.
It's something we just all
Yeah.
kind of beating the drum for.
Yeah, and I think that brings up a really good point. It kind of goes back to, something I said that I hope people heard is that it's important to bring on to your initiatives the people who are impacted by what you're wanting to do. Because you just may be, and this happens with tech companies too, like they built something or they've added something to the product. They're like, wow, we're so excited about it. It's like, actually, you're causing five more problems. But they don't know, they're just like, made this thing do this really cool thing.
Yeah.
And so bringing people along in the initiative who they may not be the decision makers, and that's fine, but they can inform really what the problem is. Are we truly solving the problem? If we are creating additional workflows, let's say, let's be sure that we're anticipating that and not just, leaving it because we don't have that knowledge.
Yeah, I think that's great, and one thing to kinda end on it as we start, wrapping up and looking to the future of hopefully everyone joining us at ViVE in February,
Hmm.
but also wherever else you meet people at other events or networking opportunities. May everyone wants to get in front of the decision maker, which obviously that's so important and obvious, but bringing in those frontline workers, those that are maybe just a couple steps down that are really in the
Hmm.
thick of it, are happy, I'm sure, to kinda tell you a little about their struggles. And then you
Yes.
in the waters, that's so important. Even if it's just one or two, to kind of really understand it before you go to that decision maker. You're just really
Hmm. Hmm.
prepared. So I think that's
Hmm.
a reminder.
Yeah, for sure. Absolutely.
Awesome. Well, thank you so much for your time again, Vanessa.